During a cardiac arrest, a new method of treatment, using a machine that lowers body temperature in order to slow down body function, has helped save lives. Dr. Richard Haskell of Hoag Memorial Hospital Presbyterian in Newport Beach explains this unique machine and what it can do for the patient.
Cardiac arrest is when the heart stops beating from whatever cause. So it can be through a heart attack or a heart rhythm problem is the most common reason. If the heart stops, then blood flow to the brain stops. And so they have to resume blood flow somehow. So they either get the heart started again, sometimes it spontaneously starts back up, or it can be shocked back into a regular rhythm, or they have to do CPR, waiting for somebody to shock it back into a regular rhythm. The brain starts being damaged in around 3 minutes. Other organs start being damaged around 5 to 8 minutes. And if somebody goes for 10 minutes without any blood flow, they're not going to do real well. What they discovered many years ago is that when people are very, very cold, the body functions slow down so much that oftentimes they can get by without much blood flow or oxygen, and that's like suspended animation. So the idea would be to create that same environment in somebody who's had cardiac arrest and prevent brain damage and allow the body to heal itself over the next 24 to 48 hours. They've devised a machine that allows the body to be cooled down very quickly, and what it does is covers most of the patient's exposed body and then allows them to be cooled down very quickly and then monitors how cool they are and keeps them at that temperature. So it's like putting them in a refrigerator, but in the old days they would just pack people in ice. You wouldn't know how cold they were and you had no way of regulating it. So this is a machine that not only cools them down but then regulates it so it keeps them at that correct temperature. The patient comes in comatose because they had no circulation, and then what we're trying to do is keep them asleep for the next 24 hours, because it would be like being in a frozen ice bath. It's very uncomfortable, so we not only keep them asleep but sedate them very heavily for the full 24 hours and will not wake them up and stop the sedation until they warm back up to normal temperature. Hoag Hospital's had this for over a year now, and we have a concerted effort between the emergency room physician, because the patients are coming in through the emergency room, the physician taking care of the patient, so often that is a cardiologist. It can also be a neurologist or a neurosurgeon, and then the intensive care physicians who are going to be helping take care of the patient over the next 24 to 48 hours while this device is in place. So oftentimes we'll recognize that the patient has a problem, start the process in the emergency room before they've even had a chance to get to the intensive care unit. So the idea is to start it as soon as possible. We've had several patients who have come through the process. Obviously, we don't know if they would have done well with or without the device, but it's surprising to me how many of them have done well. The first patient we used it on was a 50-year-old gentleman who had a cardiac arrest on the golf course. He got to the emergency room, he was resuscitated, his heart was restarted, but his brain had been damaged by lack of blood flow for a period of time. He was started on the device. 48 hours later, he was awake, and 4 days after that, he left the hospital completely intact. His brain is back to normal. That's what we want. So the data is pretty compelling that if you don't use these devices, the chances of an out-of-hospital cardiac arrest, leaving the hospital intact, meaning walking, talking, normally functioning, is about 25%. With the device, it goes up to about 50%. So it's a nearly doubling of the chances of meaningful survival. What we want is for people to be normal, to be alive, and not being able to talk or move or in a vegetative state is not success. So what we want is to be all the way back to normal if possible.